So as we're about to start blood components preparation, that's like, all right, trying to look at where blood transfusion is actually heading. You know, that a patient could actually come to the clinic and they just need red blood cells. So I'm not transfusing what, all the whole blood into them. I'm only transferring what, red blood cells. Do you understand that kind of thing? So let's just look at the learning objectives and course outline, so that students will know what they are expecting. Students will know what they are expecting for, you know, this session. So for learning objectives, by the end of this blood component preparation, you should be able to understand generally understanding the principles that guide blood component therapy. Now you know why we are transfusing blood to a patient, okay, and why we shouldn't. If it is red blood cells, you are knowing why they're actually transferring red blood cells to a person. That's why that means you are actually knowing the importance or uses of these red blood cells in depth. You know, you can be able to differentiate between the cellular and the non-cellular component of blood. You should be able to differentiate between indirect and direct Combs testing. You should be able to differentiate between forward and backward blood grouping, which we'll be having lectures on it. You should be able to differentiate between immediate and delayed complication of blood transfusion. Also be able to identify the alternatives to blood transfusion, because it's not every time that, you know, it must be blood transfusion, it must be blood transfusion, it must be blood transfusion. Do you understand? There are some other things that could actually help you still, you know, retain the levels of blood in the body, all right, without necessarily going under blood transfusion. So for the course outline, we'll go on the introduction. We'll talk about blood component therapies generally. We'll talk about why patient might actually need red blood cells only. We'll talk about why patient might need only platelets only. We'll talk about why patients might need fresh frozen plasma only. We'll talk about why patient might need cryoprecipitate only. We'll talk about blood component processing. We'll talk about antibody screening, okay? So cross-matching and compatibility testing. We'll talk about complications of blood transfusion and its management. Then we'll talk about other things that you could actually give, okay, to replace blood in the body. Do you understand? Then conclusion is also there. Okay, so that's it.